Hello, I'm Dr. Greg Wintereg. I'm a dentist and a partner at MGE. And for this week's tip of the week, I would like to talk about how you respond when the patient is asking for a better deal. Is that as good as you can do? Well, it definitely puts you in an uncomfortable position. But I'm going to say right now, I don't think you should lower your fees. The problem with this is that, let's say it's $1,000 and you agree to do it for $800. And you go, well, I could do it for $800. And the first thought that's going to go through their mind is, darn it, I should have asked for $700. Or could he go lower? Or to me, the effect it creates on the patient is, yeah, I kind of figured he was overcharging. So in my mind, as soon as you lower your price, as soon as you start giving the patient a deal, you're trying to help them out, what it means is everybody else is being overcharged. And honestly, I think it makes us kind of look like a con man, a con artist, is like, well, we're not being genuine, we're not being honest. And I think, quite honestly, it's unprofessional and invalidates us. I know the temptation is there, and there are definitely people out there who have to have the lowest price. So when the patients asked me to lower my fees, I just very calmly and confidently looked at them and said, if you want the cheapest dentist in town, I'm not your guy. And then I would explain how I use the best materials, I pay my staff well, I go to constant continuing education so that I can deliver the best dentistry possible, and my fees are my fees. So I just made it a personal policy that I did not negotiate my fees because I thought then it invalidated everything else I did, and I personally don't think that's a practice builder. Now, all of that being said, I did offer a 5% paid in full bookkeeping discount. Now, that's a lot different than a cash discount or a pay today discount. The bookkeeping discount was I did not have to send out any statements. The insurance check was going to go directly to the patient. There's no postage, there's no staff time. All my paperwork with this patient then at that point is done. And from a business standpoint, that's a good business decision for me. And I'll tell you, I got the idea from my lab man who gave me a 3% discount on my lab bill if I paid it within 10 days. So it's a similar concept. That's a common concept that's accepted in business today, but it's not giving a deal just to get the close. That's my tip of the week. If you want more of these, just click on the subscribe button, and there's lots more where this came from.